Thank you so much for joining us, Glenn. Talk a little bit about what your company does and how you've been involved in fighting COVID-19.
Sure. Well, good morning. Let me first start off by saying our hearts go out to all the people who've lost loved ones to the coronavirus, and also to the real heroes of this challenge, the doctors, the nurses, the professional caregivers. They're doing an extraordinary job, and we just wanted to do a shout out to them from Livongo. What we're focused on is remote patient monitoring. In fact, we just heard David Cordani talking about telehealth, and the country's been educated to what telehealth is now. And if you like telehealth, you're going to love remote patient monitoring, because what we do is meet people where they are and allow them, empower them to take care of themselves when they're at home. And let me tell you why this is particularly important. In fact, if your viewers take away only one thing from this segment, it should be that last week it was reported 90% of all the deaths from coronavirus in New York were for people with pre-existing conditions or chronic conditions. And what the experts have said is those groups of people who are very vulnerable should not be showing up at the ER, should not be going to the hospital. They should be staying home. But you need to be able to monitor them to keep them safe at home. And that's what Livongo is doing through our technology. So it's, we're happy to be there for more than 250,000 people today and growing, because this has caught the attention of health insurers, of health providers, and even of the government as well.
So with your monitoring and your biometric data on the more vulnerable population, what have you learned in terms of just how vulnerable they are and what sort of conditions are most at risk?
Well, when you think about people with diabetes or hypertension or weight management problems, they are not more likely to get coronavirus. But if they get it, they're much more at risk. And that relates to that 90% figure I just talked about. So we have to keep that group of people, again, away from the hot spots, away from where the infections are. And that's today at the hospitals, at the doctor's office, at the emergency room. So the best thing to do, shelter in home, as you've heard. And again, if you think about healthcare in the future, this is probably the most serious challenge our country has faced in a long, long time. And yet, after we get through it, we will get through it, and we'll get through it together, but we will get through it. We're going to see fundamental changes across a variety of industries. People will figure out you can do education at home. They've already figured out how to use Amazon, but now a much larger group is going to get their groceries and other goods through Amazon. And they're using Zoom. Everybody's using Zoom today and other technologies like that. But the biggest change is going to come in healthcare. We're going to understand that we can do healthcare remotely. We can actually provide remote tools that keep people healthy, and then focus our physicians, who are so critical, on the people who really need their care, not on doing checkups that can be automated today. So we're going to see these fundamental shifts. And in fact, remote patient monitoring, we believe, is going to become, along with telehealth, a new standard of care. And that's what we're talking with all of our clients about, whether they be the large, Fortune 100 companies, whether they be payers or provider systems, or even the government, where we have more than 5 million government members where we're covered benefits. So all those groups are starting to look at this remote patient monitoring as the way to do things. And again, giving people 24/7 access, giving them all of what we get from all the other digital services we like, but turning that energy to healthcare. That's what we're focused on at Livongo.
Glenn, it's Jim. I think people should know that you got involved because your boy has type 1 diabetes, and I hope he's doing fine.
He is. Thanks for asking.
Let me parse what you said. You've got a group that's very at risk, and they're not at risk because of their own fault, but they really could be helped by a national lockdown, or a lockdown that's like what's going on in California. Do you find the patchwork notion of where you can go and where you can't, and what beach you can be on and what beach you can't, and what streets you can be on, do you find it unnerving for your own customers who truly need the protection of a stay-at-home lockdown?
Well, look, we would benefit from from federal leadership, and we just haven't seen it. We've seen some great leadership from states, from the governors, from New York, from Illinois, from California. It'd be great if we had better leadership. Interestingly, there was a great study out, and I know you were talking with David Cordani earlier about the reasons some countries have done better. There's a very interesting study that talks about the countries that are used to wearing masks. And basically that's, Japan, it's Taiwan, it's South Korea. If you get on a subway in Japan, it's very common to see most people forget about coronavirus just on a normal day wearing a mask over their face. Those countries have had dramatically less incident of coronavirus. So 1, social distancing, 2, wearing masks, and 3, being smart about getting together in groups. I think that is as important as trying to put in artificial lockdowns, because big parts of the economy don't have the luxury of not going to work. Again, we talked about our brave physicians and caregivers, but there's delivery people, there's people who cook for us, there's people in stores. So the lockdown, we want to be sensible, and we've got to push people. In Chicago, we closed the running trails. We've done very smart things to keep people from congregating, and we all have to be good to each other by doing social distancing. When I was in the studio the last time, it was the first time we didn't do a fist bump. So, even you are practicing it aggressively, I know, and that was before we saw the real spike in the US. So I think that there's things we can do. I'm not sure a national locking down certain areas of the country is the best solution, but we know what does work. Social distancing, wearing a mask, washing your hands, all the things we've been told repeatedly. And again, our companies have stepped up across the board by allowing people to use digital technologies and work from home. And now we're seeing the health system start to embrace digital technologies. And once we unleash that genie, it won't go back in. So people will say, if I can do my appointment remotely now, I can do it in the future and save the travel time.